We were notified on May 4th, which is 2 weeks ago, that we could bring back our hygiene department, which was the non-essential services, the teeth cleanings, the exams, the x-rays, and we had the staff come back. Very excited. We welcomed them back on Friday before the 4th just to talk to them and let them know how we were going to proceed with precautions and guidelines, and they were thrilled to be back, and our patients were very happy to get back into some kind of normal. I've been practicing for 31 years, so we've been doing a lot of these procedures and protocols before this COVID happened, but anything that's disposable, like disposable gowns, we wear now to make the patients feel safer. We also have a way to sterilize the air with UVC lighting, so it purifies the air for aerosols. Other than that, we do anything that we can do touchless. We do, even as far as paying for treatment, we use the Apple Pay or the Samsung Pay, so the patient can use their watch, or they can tap or just touch, so they don't have to hand their credit card off. And then other things, taking temperatures before patients come into the office. Fortunately, the weather is good. What we're going to be employing Athena. It's a new way to take temperatures as patients come in without putting the temperature on their forehead. It reads their thermal profile on their face and relates it to a heat source. So it's all automatic. As they come in, people's temperatures are taken, and it notifies the front desk if someone has an elevated temperature that we have to address with the patient. But that's coming soon. We work with Henry Schein Dental, which is, they've been our partner for quite a while, but we've had to try to patchwork our network together from different distributors. So sometimes I might get the masks that I like. Sometimes I'll get a mask that I don't like, but we're very fortunate that we can get it. But it was difficult to get that.
In school, the first thing that they teach us is you treat everyone as if they had an infectious disease. So we treat everyone the same, as if they do have something. So we're cleaning already very well. Now we're just adding another cleaning on top of what we're already sanitizing.
It's different for me because patients come in with masks. So I feel like we're all part of the same team, in other words. But when patients sit down, they have their mask on, and I'll be ready to start working, and the assistant's ready to start. We have our instruments, we're looking at the patient, they still have their mask on, and we're hoping they take the hint, we're ready, we can't work through your mask, so we have to tell them to lower their mask. So it's kind of funny, and like, oh, I forgot I had it on. Between the patients coming in with their own masks, we also have them rinse out with a peroxide rinse before we start to lower the bacteria count in the mouth, and it's shown to help with spread of aerosols. So we do that. We take the temperature. We make sure we go through a health questionnaire to make sure the obvious things, if you traveled and had a fever and those things. So getting all that done has been wonderful. What we're working on is trying to get the business of dentistry moved to the patient's living room. So instead of doing the consent form, the questions, the video, the payment for the services, we're packaging that so that can be emailed to the patient or texted to the patient. So when they come, they just come to the chair, they get their dental work done, and then they go home. There's no stops in between. So that's a process that's a little bit different, and that we're working on that to make that happen.